In addition to the concepts we presented in the previous videos, there are a few concepts very important to understand the way we see pathological mechanism in Chinese medicine. These concepts include dampness, phlegm, Qi constraint, Qi stagnation, blood stasis, food stagnation, and wind. The term dampness refers to the metabolic waste building up in our body. If the spleen is too weak, it is unable to process dampness, which will pile up and overwhelm the weak spleen. Manifestations of dampness include a thick tongue coating, feeling of body heaviness, and bloating. Phlegm is a condensed version of dampness, but there is a large degree of overlap between dampness and phlegm, which can be both called turbid. In general, we tend to talk about phlegm instead of dampness in the context of respiratory, cardiac, and psychological conditions. Qi stagnation refers to a blockage in the body, resulting in the impairment of physiological activities such as digestive, respiratory, and cardiac functions. There can be blockage in the limbs as well, in the context of arthritis, for example. Qi stagnation is generally accompanied with distension and pain. Qi constraint is a form of Qi stagnation that is generally caused by excessive emotion and that is strongly associated with fire. Food stagnation is literally when food is stuck in the gut, causing bloating, nausea, and diarrhea. Food stagnation is quite common in young children. Blood stasis referred to the inability of blood to move freely in the blood vessels. It is related with the blood being too thick and blood vessels being hardened and narrow. But the concept of blood stasis also encompasses pain condition and mental conditions that are not directly related with blood circulation. In Chinese medicine, we use the concept of wind to refer to pathological situations associated with movements such as vertigo, object moving around, convulsions, involuntary movements of limbs, and itching, feeling of something moving in the skin. I am Yoann Birling, a clinician, lecturer, and researcher in Chinese medicine. Please feel free to like this video if you did, and subscribe to our channel for more videos on health, psychology, and Chinese medicine.